Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Dr. Grove, how you doing today?
Doc, how are we doing? Good morning.
I'm living it up. What are we going to teach people about today?
We're talking about musculoskeletal injuries and how we can use regenerative medicine, platelets and stem cells to help with some of your pain.
Yeah, and you've been around a long time in this kind of business. I've been around for, I think 27 years now, and you've been in it about a dozen years. And what have you seen on using stem cells and platelets versus doing a surgery? We know that surgery is, I'd say, the mainstay of traditional medicine, whereas regenerative medicine, although a lot of doctors still don't really believe in it or know about it, has actually been around in one form or another since the beginning of time. And I don't know how much you've read about this yourself, but we have studies from if you want to call it studies, actually it's more people talking about and writing about Hippocrates, the father of Western medicine, using prolotherapy for the Olympian athletes, people like javelin throwers that would dislocate their shoulders. And do you know what he used to do with them?
Yeah, they used to kind of burn the axle or the armpit, right, just to tighten everything up. Yeah, we've come a long way since burning armpits. Yeah.
And what that would do is it would shrink up the collagen. And by the way, collagen is the major constituent in cartilage, which is the covering of our bones and our joints. And then there's stories way back 5,000 years ago in China with their healers using acupuncture needles to do a crude form of what's called prolotherapy, proliferative therapy. And they used to call it sclerotherapy, which means to scar. And we now know that what we do today is not scarring at all. It's growing brand new collagen and brand new cartilage. Helps get rid of things like arthritis, neck pain, back pain, shoulder pain, muscle tears, ligament and tendon tears, hip arthritis, knee arthritis, meniscal tears, really all over the body. And Dr. Grove, I'm so happy to report, is probably one of the top ultrasound-guided injectors on the planet. And I watch him all the time, and his ability to see inside the body with the use of an ultrasound is absolutely amazing. And I love watching you in motion, Dr. Grove. You're a great guy, and he's a great big handsome dude. All the women in the office want to know, who is this guy? He's 6'2", 230 pounds, really, of steel muscle. He pumps up, what is it, twice a day?
Twice a day, yeah. I got to stay active out there, We're both the same, Doc. We're a little hyperactive, We got a lot of energy. Got to give out to the world, right? Yeah. No, it's really amazing stuff. We're in a really exciting time right now with sports medicine, musculoskeletal medicine, where we've got guys like Dr. Darrow who are pioneers in the field that really wanted to make a platform, right, for advanced training, advanced imaging, advanced, the stuff we're putting in the syringe called injectate, right, So you were one of the original guys using prolotherapy, right? That's sugar water. Then we found that platelets worked really well. That's in PRP, or platelet-rich plasma. And then we found that stem cells work even better than that, right? We get those stem cells from the patient's own bone marrow. All these procedures are very fast. You come into the clinic, you walk in, you get your treatment, you walk out without the risk of general anesthesia, without the risk of surgery. Again, we have very similar paths too. We love surgery, so much fun to do, so much respect for surgeons. Problem with surgery is the complication rate. You know, when you're opening up joints and you're opening up these very big areas of tissue, right, you're going to get infections, unfortunately, right? Sometimes that hardware that they put in for, let's say, an artificial joint replacement, like a knee replacement or a hip replacement, sometimes those get a little loose. Sometimes they get infections. You got to go in, you got to clean it out. You have to have another joint replacement after that. Anesthesia itself can be kind of a risky medication. And what we do here, complication rates don't really have that same sort of risk factor, right?
You know, we had a woman come in yesterday, and she was considering getting a hip replacement, and the doctor was a real salesman. I mean, he just said, you know, this is going to be good for 20 years. And my experience with this is we have people coming back with joint replacements that didn't work at all to begin with, or that down the road wear out the bone, because you're putting metal inside of bone. You amputate, you know, one part of the joint, and then often the other part of the joint. You take the bone off, you cut it off, and then put in a metal prosthesis. Metal is really hard. Bone, although we think of it as hard, is really soft. It's really a soft tissue in a sense. And it can actually wear out very easily. And then what do? The bone is worn out. It's worn down. You have to put in a bigger prosthesis. There was a case that I had actually when I was an intern in Denver. I was doing orthopedic surgery, and of course I wasn't the surgeon. I was the backup guy holding clamps and stuff as an intern. And a person came in who had had a hip replacement, and then they tried to put in a new one because the old one failed, and it cracked the bone. So what this surgeon that I was working with did, he was probably one of the top joint replacement surgeons on the planet, because he would get sent all the impossible cases from all over the world. And he was what I'll call a Denver cowboy. He was a great big guy. He had a great big silver belt buckle and big mouth, you know, wonderful guy. He could talk you under the table anytime. And what he did during a surgery, it was like a 9-hour surgery we did, he took a cadaver femur, that's bone from a dead guy, and carved it right in the operating room to fit into where the other femur that failed was. Cut out that femur, put in a new one. Now, what do you think the chance of that actually healing was?
Not great.
Not great.
Yeah.
But the person didn't want an amputation. They were willing to go through the risks, which really were horrendous, because it was an active person. So, you know, there's surgeons that'll do anything, and I've seen things that I can't believe. And this isn't a put down on surgeons. I mean, they're trying to do good. The one of the most abominations I've seen was a woman that came in with low back pain, and I think I told you about this, Dr. Grove, and she had what's called a hyperlordotic curve in her back, where there was a big curve at the low back. And when I examined her, I saw a scar all across the back. And I said, "What? You had a surgery? What was it for?" She said, "I had a pelvic lift."
Oh my!
I bet you never heard of that one before.
I don't think I see. They don't do those anymore.
Well, they never did one before either.
Yeah.
But anyway, it failed miserably. And, you know, my hat's off to the surgeon who did that, because he thought he was doing good. I think everybody in medicine thinks they're doing good. Let me give out the phone number a couple of times, and our website and our office number. So if people want to call in, if you want to talk to us live, get a pencil and write this down. If you're driving, see if you can pull off to the side of the road if you want to call in. So the phone number to call us is 866-870-5752. Get ready. I'm going to give it out again. 866-870-5752. and that'll get you right in to talk to Dr. Grove and I, and you can talk about anything you like, but we want you to hopefully specify something about musculoskeletal orthopedic type pain, anything from the head all the way down to the toes, anything that your family has, your friends have, and if you're shy, you can give a fake name, and we'll be nice to you. We love having callers because we talk fast and we can get through the show quickly, but it'd be nice to have some examples of people with what their pain is. So again, the phone number to the studio live right now is 866-870-5752. And then if you want to call the office and get a free phone consult with our staff, that's just a free phone consult with our staff, and their phone number, and they're actually by the phones right now, is 800-300-9300. That's 800-300-9300. And if you want to watch these procedures actually being done with stem cells and PRP, platelet-rich plasma, you can look at our website, which has tons of videos on it and tons of research studies. That's the thing that I think is so important, is to know that this is not something being made up by woo-woo doctors. This is something that's being studied, and I'm going to say there is probably more research being done in the field of regenerative medicine of platelets and stem cells than just about anything else today. So the website is www.jointrehab.com. That's www.jointrehab.com. And you can email us on every single page there. I get back to every single person who emails in. And actually, before the radio show early this morning, I was texted by a woman in Atlanta, Georgia, who was thinking of coming in. And she said, I'm scheduled for a knee replacement in a few days, and I read about what you're doing, and I'm terrified about the knee replacement, but I think it's better if I actually fly in to see you and at least have a consult to see if I need the knee replacement or not. And we hear it all day long, Dr. Grove. What do we hear about people being told?
Every single day I get someone coming into the office and they're being, I call it being bullied into thinking they need a full joint replacement because they're told they have bone-on-bone arthritis. It's a triggering phrase for us, right? So true bone-on-bone arthritis would mean you have no cartilage, right? So most people that are walking around, you're not bone-on-bone. And I can show you clear as day on the ultrasound. I lay you down, scan you in real time using an ultrasound, which is a really fantastic tool where you can look real time at that soft tissue. We can look at how much cartilage is there. We can look at all the ligaments, the tendons, the muscles around that area where you're experiencing some pain. And clear as day, I can show you still have some cartilage left in there. And again, when you're looking at joint replacement, you can't really go backwards. Once that joint is replaced, you get a little bit more limited in what you're able to do down the line, right? So as much as you can, just get information. You know, we're not trying to tell anybody what to do, but consultations are really just about educating patients.
Yeah, and that's really what our job is. You know, the job, I think, of any doctor, and this is a story that I tell people all the time. I got to medical school, and the school I went to did not have classes. It had what's called problem-based learning. They do it at Harvard. And it really puts the students on the pedestal of being fearful because they have to do the research and then come in and teach each other. So it's threatening. And I would walk out, we'd have like 4 or 5 hour sessions, and a doctor would be in the room with 4, 5, 6 of us and give us a problem set. You know, like 34-year-old man with knee pain, can't bend his knee, blah, 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 or breast cancer, or this or that, whatever it was that we were dealing with. And then we would have to assign learning issues, and then each student would go to the library, research, and then come back the next session and teach every other person. So I would walk out sweating when it was my turn to, I would, because I didn't know anything except what I just learned, you know, in the past few days about the science of what was going on in medicine. We didn't have book work. We didn't have lectures. It's a very, very difficult way to learn, but it really makes you learn a lot. And it's called problem-based learning. Some of the best schools in the world do that. So what am I getting at here? We had to learn the hard way, and probably the best way. It wasn't good for teaching us about getting through our boards. We had to learn the science exactly on our own. But it was a great way. Our Dean of Admissions wanted our class to be the first class that related to people very well. He wasn't that interested in doctors being scientists. He wanted doctors who were there to help people, who could communicate. And that's what this taught us how to do. Are you familiar with that form of teaching?
Yeah,
Dr.
it's called PBL, or problem-based learning. It's a really popular learning pathway. So a lot of medical schools now give that as an option. So you can do just lecture, in person. You can do the problem-based learning. You do a combination. So that's what I experienced. But you're bringing up really, really good points. I ended up doing well on the MCAT, which is the entrance exam for medical school. I ended up teaching and tutoring for that priorly for a couple of years before I actually started the medical journey. And you really learn, if you know what you're talking about, if you can teach it to somebody else, right? And like you said, it's just such an important aspect of providing healthcare to people is you got to be able to communicate what you think is going on. Patients got to understand it, properly giving them informed consent of what the actual risks are of what you're talking about, and just laying out options that you can understand.
And something else, both of us spend a lot of time with our patients. We both give out our cell numbers to every patient. And people say, well, I don't want to bother you. And I go, you're going to bother me if you don't call me if you have an issue, because you can screw it up unless you talk to me. And we get calls all day, all night. Mm-hmm. I always tell my patients, you can call me at 3 or 4 in the morning. It's not going to bother me because I turn my phone off when I go to sleep. And I do stay up late. And I love talking to people. Both of us are very communicative people. And I think it's the loving of the patient that matters more than anything else. And that's, I think, how people heal. It's through the love of the doctor. And it's just a lot of fun doing what we do. We laugh, Dr. Grove and I laugh together every day at the healings we see using stem cells and platelets for people that were told things like, you have bone on bone, you have to have a surgery. And it just isn't true in most cases. It's very rare that we see patients that actually need to have an orthopedic surgical procedures. Obviously, if someone has a broken bone, get to the surgeon. But for these things like meniscal tears, rotator cuff tears, arthritis, and whatnot, we just don't see that it needs to be done.
Strongly agree. And again, you guys got to remember, it's an elective procedure, right? Elective meaning the patient gets to choose.
Yeah.
And every day I hear patients, they're being told they have to do X, Y, Z. Remember, guys, this is an elective situation. It is always your choice in terms of what you want to do.
And you have to be so careful not to confuse the pathology with the reality. Do you want to explain what that means, Dr.
Exactly.
Grove?
So if you're just looking at what an image shows, right? So if you get an x-ray and the angle's off maybe a little bit, or if you get an MRI and you're seeing maybe like a disc bulge in your back, there's a lot of things that we know now are just a normal part of aging that don't necessarily correlate with what your symptoms are. So just because you see it on imaging and it's not quote unquote perfectly normal does not mean that's the source of your discomfort. And that's the job of the physician to kind of tease that out.
And the thing that you just said, I want to expound on a little bit. You mentioned the angle of the film.
Mm-hmm.
If you're getting an x-ray and the x-ray device is a little bit too high, it's going to shoot down at the wrong angle, and it'll look like you don't have any cartilage.
Exactly. And that's a really great lesson I learned in my, I did a sports medicine fellowship, amazing institution at Virginia Tech, and very challenging at the time because we showed up to campus and they said, hey, listen, I know you guys are probably used to just ordering your imaging tests, but here you're going to order them and you're going to do them. So we would take our athletes, and I was the guy being the radiology tech. I'm the one maneuvering them around, operating the system, shooting the x-ray, interpreting the x-ray myself. And, you're not perfect the first couple of times you do this, and you realize how easy it is to get an image that doesn't really show you truly what's going on. And more importantly, you got to do a proper physical exam. You got to put hands on patients.
Yeah. And way too often we have patients come in post-surgery when it failed, and I say, did the doctor ever touch your body? No, they just put the image up on the screen, either an MRI, CT, X-ray, and said you need surgery, and explained what it was. And I just had a woman recently who got better from our treatments and then ended up getting a joint replacement. And I said, why did you do that? Mm-hmm. I looked at her notes. She was 50% better. She said the surgeon said that I was bone on bone. She was not bone on bone. She was moving around. She was walking. But whatever image it was, read it falsely. That's what we call the pathology versus the reality. Pathology is, the illness or what's wrong. And the reality is what's going on with the person. We get people all the time that are quoted to have terrible arthritis, ready for a surgery. And then we move them around, we touch them, and we go, you may have arthritis, but it's not limiting you. Mm-hmm. So you can't confuse the reality with the pathology. Be very careful when your doctor tells you you need to do something. Get second, third opinions, and don't go to the same type of doctor. Go to a different type of doctor. If you're going to go to the same type of doctor over and over, you're going to get the same type of a response because that is their culture. And obviously you want to be conservative in medicine. That's the first law of medicine, is do no harm. So the knife is not the first way to look at things in medicine, as far as I am concerned. Like Dr. Grove said, we loved doing surgery. That was, to me, one of the most fun things on the planet. But we just saw too many bad results, and you might say we switched horses midstream and moved into using what we call regenerative medicine, where we actually grow tissue back. And when I would lecture, I lectured for years. I taught at UCLA for 20 years. Many doctors go, well, there's no research on this. So what I did, I created a book. It's 200 pages long. It's got 256 studies in it. These are actual scientific studies showing how tissue actually grows. And we can do that very simply by just a simple injection. Like Dr. Grove said, you walk in the office, you get your injections, and you walk out. You don't need any kind of anesthesia. You don't need anybody to drive you there. I want to give out a free copy of our book, and the book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got a foreword by the lovely Suzanne Summers. Rest in peace. God bless you, Suzanne Summers. And the way to get the book is give us a call right now. Talk to us live. Write this down, 866-870-5752. You can also call the office at 800-300-9300. And you can email us through the website. Every page on the website has a spot to email us, and we answer them every single day. And that's www.jointrehab.com. So we're going to be going to a break fairly soon. I want to get some questions out there. So, Dr. Grove, do you have any questions that have come in through emails that you'd like to go over?
Yeah, so we had a kind of an interesting case earlier this week. Got emailed, ended up connecting with this patient about some knee pain. They were told they needed a joint replacement. And just to echo what we've been talking about, we brought this patient in, physical exam. Her pain was not coming from arthritis, which is what they were telling her, hey, it's the arthritic pain. You need a joint replacement. And for her, it was just a ligament problem, right? So a ligament is a piece of tissue that connects a bone to another bone. In this case, it was her MCL, or medial collateral ligament. It's kind of a little piece of tissue that runs on the inside of the knee, provides stability. But for her, she had a tennis injury. She's playing tennis, had a fall, landed awkwardly, had some pain on the inside of her knee. And again, you can see it clear as day on the ultrasound. She had a little partial tear of that MCL. You press right on it, you stress that tissue. That's exactly where her pain was. And I just talked to her this morning, and she's already doing great, about a week out from her treatment. So
I love it.
Another really, really important aspect is you got to put hands on patients. You can't assume anything in terms of where pain's coming from. If you don't truly understand the anatomy of the human body, you can't really pinpoint where you think someone's pain's coming from, right? I mean, a knee replacement wouldn't even fix that problem, right? I mean, you'd be taking bones out, but the ligament would still be the problem. So those sort of problems we see all the time here, and just reiterating, make sure you guys are getting people that are putting hands on you before you're making big decisions like having surgery.
Yeah. Yeah, and that's what we call the pathology versus the reality. We see it every single day. People come in with a diagnosis that is wrong. And it could be any kind of a doctor. We're going to go to the break. So hang with us, everybody. We have a caller coming in, which we'll grab right after the break. And if you want to reach us live, give us a call right now, 866-870-5752. That's 866-870-5752. And if you want to call the office, that's 800-300-9300. Hang with us here.
You're listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.